Hello everyone. Wish you all had good day up to now, and you're doing great during this pandemic. We are experiencing severe conditions now, I know, and I hope you're all safe and healthy. I'm going to talk about ultrasound. I'm going to talk about a little bit about ultrasound and its new frontiers in medicine. I'm. I want to mention that I try to refer to the references to the. I mean, where the videos, the content is coming from. But if I miss every, I mean, part of it, there wasn't any intention of, I mean, disrespecting the copyright. So um, please, I mean, be sure that I'm going to add any references that you find not, I mean, added here. So, what is ultrasound? This is the slide that I got from one of the recent webinars that one of the frontiers in the focused ultrasound field is uh, he is the chairman of the Focused Ultrasound Foundation. He says that the focused ultrasound is the most powerful sound that you have experienced in your life, but you will never hear it. But even this sound that you could not hear it would, I mean, could someday save our lives. And today we are going to discuss what is ultrasound and how we believe that this, I mean, technology, this kind of sound can save our lives. Okay. So in order to explain what is ultrasound, I have got a video from Khan Academy, and as you can see, this is a speaker, and this is a routine speaker that we see in our daily life. It is embedded in your laptop, in your TV, in your cell phone. So if we plug the speaker, if we give it the electric field and we plug it to the electricity, then the speaker will make sound. But how? Through this diaphragm, and it can produce sound. This interface, the diaphragm, is going to oscillate and move back and front, so it can make sound in this way. But and if you put a piece of paper on this diaphragm, you realize that this piece of paper is moving. So this shows that there is kind of a motion and movement right right close to the diaphragm. So this is exactly how sound is transmitted to our ear. This diaphragm is moving, and it causes that oscillatory movement in the close, molecular layer. These are, for example, air molecule layers. So uh, these molecules are going to move the um, next molecular layer, and then the other molecule, and then this wave, this kind of movement is going to reach our eye, and it kind of um, transmits the energy, the sound energy, to our ear, and we can hear what the speaker is playing. So as you now hearing my voice through your laptop or your cell phone, the same principle is, occurring. So the sound is kind of a wave because it can transmit an energy in a media. So this media is where the sound is traveling. This media can be air, can be water, it can be metal and different things, and even it can be tissue and different organs of our body. So, and also I want to mention here that this movement of the particles, this movement of the air particles, is kind of a harmonic wave movement and motion. So the same principle that I discuss here about diaphragm is the same concept and principally occurring in the medical ultrasound. But the fact is that the ultrasound is in a range of frequency that it's not audible to us, and we cannot hear the sound, but there exists, it exists in the media, and it is, transmitting and traveling through the media. When we talk about the medical ultrasound, the first thing that came to our mind is the medical ultrasound for imaging. Everyone has heard it, and they use it for pregnancy. They use it to take picture from different areas of the different organs of the body. But let's see how this medical ultrasound probe for imaging works. This is the medical ultrasound probe. For imaging, it consists of a lot of piezoelectric layers, and if you get one of these layers, and this piezoelectric layer has piezoelectric effect, and the piezoelectric effect means that if you apply electric field to this layer, it will produce some kind of movement, and it can move and make exactly the same, show exactly the same behavior as the diaphragm in the speaker does. So it can produce sound waves, as you can see in the video. But there's something else happening here. When you have these sounds transmitted back or reflected, or even a sound from other sources, and reaching to this piezoelectric layer, the vice versa or the reverse process is also happening, and the piezoelectric is going to produce electrical signal, which is used for imaging in here. That the probe makes the ultrasound wave and the sound waves and transmit it to our organ. Then it captures the reflected sound from the organ to generate those pictures. And if we collect all those electric signals from all of these piezoelectric layers, we will generate these fantastic images, for example, in pregnancy to see the baby, or whether it is a heart valve or different parts of the body. So this is the principle of ultrasound for imaging. But now on, I'm going to discuss the medical, or let's say biophysical effects of the ultrasound in our body. Here, there's a cartoon video about piezoelectric, about the effect of the, these piezoelectric elements. If we put and plug in the electricity and give this piezoelectric electricity, then it will going to make sound waves around or in the surrounding media. And if we put it in a, let's say, tissue or a tissue phantom, then the tissue phantom's molecules are going to oscillate. So this is the effect that we will see, and we will discuss about the effects of the ultrasound more. But if you use these elements, a bunch of these elements, and arrange them in a spherical shape probe, then and put it close to the this tissue or tissue phantom, then some amazing biophysical effects, medical effects are appearing in the media. This is called the focused ultrasound. So why? Because you have arranged the piezoelectric modules in a way that all the transmitted ultrasound waves are focused and gathered in a tiny region, which is called the focal point or focal region. There are two kinds of focused ultrasound. There are high intensity focused ultrasound and low intensity focused ultrasound, and there are two main categories for the effects of the ultrasound. Although there are a lot of other effects, as Neil Kimmel, Focused Ultrasound chairman, says there are 18 different effects that focused ultrasound can cause in our tissue, but there are two main categories that whether they are thermal or non-thermal effects. So this thermal effect is presented mostly in the HIFU, high intensity focused ultrasound, and the non-thermal effect is present in both of them, both LIFU and HIFU, and could be used in medical stuff. So here you can see there is a this is a testing chamber which is filled with water, and at the right hand side you can see a HIFU probe, which is a spherical probe of piezoelectric elements and modules. And on the left hand side, you can see that there is a tissue phantom. And if we turn on the electricity and give electricity to the piezoelectric elements, then this spherical shape is going to make the ultrasound waves and the sound waves to be gathered and focused in the tiny region of our interest. And as you can see here in the picture, it is going to degenerate or ablate this part of tissue phantom and makes a elliptical-like focal region. So there's something amazing happening here, because when I was attending one of our courses in Sharif University of Technology, we had a course on introduction to ultrasound. So it wasn't talking about just HIFU. It was talking about ultrasound generally. So when I was studying the material, I realized that wow, this ultrasound behaves similar to optics and light's behavior in lots of ways. But yeah, they have some dissimilarities, but their similarity is much more than their dissimilarity. So the main principle happening here in the focused ultrasound is the same that is happening when you use a magnifier in front of a light media, for example, light source, for example, sun, whether it is a sun or a light bulb. Then the magnifier is going to focus all the light rays in a tiny region that produces enough energy to burn, for example, a piece of leaf or piece of paper. And this is the same principle happening in the HIFU. Or let's say focused ultrasound, not only HIFU, it's focused ultrasound. So by the means of this technology, we could gather the sound waves in a tiny region, ablate it. If we use it, in a tissue or human organ, we can ablate that part, and without harming surrounding and adjacent tissues, because when the wave is propagating in the media and reaching to its focal point, the temperature increasement or the let's say a dissipated energy in the surrounding media and tissue is not that much high to produce those thermal effects in the media. This is a picture of using ultrasound for tumor treatment in liver and brain. And as you can see, there's a fantastic happening here. It's kind of a miracle. You can see there is a great, precision here, and there is a, ultrasound could ablate the treated part of the tissue with great precision. That is, for example, tenth of 1 millimeter. So ultrasound is kind of a precise and accurate device and could be precisely located and precisely controlled to, for medical uses. So in order to discuss what's the, medical and what's the biological effect of the ultrasound, I've picked up this picture that depicts what happens when you use ultrasound in tissue and how it's working. when you use this ultrasound for tumor ablation, there are three main layers. The first, or three main parts. The first part is the central part, the central zone, in which the coagulation necrosis occurs, and the temperature is more than 50 degrees Celsius, and normally more than 15 degrees Celsius. And there's a surrounding layer, which is a transitional peripheral layer, which has a temperature of about 30 to 45 degrees Celsius. And also we have the surrounding temperature, which is a tissue, which is the normal tissue, which is it is intact and not influenced by the ultrasound. In the central zone, with the effects of the ultrasound, the cell membrane collapses, the protein denaturation occurs, there is a halt in enzyme function, and mitochondrial dysfunction also occurs. And as I mentioned, the temperature here is normally more than 50 degrees Celsius, but it can go higher and higher as how the probe is designed to produce the energy in the tissue. Then we are going to the next layer, which is the peripheral and transitional layer. In this layer, also there's still heat-induced injury in the cells and in the tissue here, but they are reversible. And what happens here is that we have halt in metabolism. We have impaired DNA repair, and as the blood circulation increases here due to the heat, the hyperemia is induced in the tissue, in the cells here, and this increases the oxygenation, sensitizes the tissue to other radiation and other means of tissue ablation, and it increases the ROS and reactive oxygen species. And when the circulation is increased, then the circulation of the liposomal agents, if for example you want to deliver let's say chemotherapy agents, then there is going to be a more chemotherapy and circulation is going to be high. And as you can see in the left hand side of the picture, the amount of the immune response, the amount of the T cells and macrophages and different kind of immune responses happening here. So it has a great modulation effect also. So then we have the normal tissues in which those let's say antigens, tumor antigens that have released from the damaged tissue or ablated tissue, and the peripheral and transitional zone will be gathered. We will go to the nearest lymphome node, and it would be used to treat the naive cell and those let's say disparate cells to attack and more increasing the immune response of the cells and body. So and one of the most now on I'm going to present some of the examples of how the ultrasound is using and treating for different cancers and different diseases. One of the most important and let's say one of the most popular treatment is the ultrasound HIFU, high intensity focused ultrasound, used for treatment of the prostate cancer, which has got the FDA approved yet. And as you can see, here is the tumor of the prostate tumor. This is the HIFU probe, and after getting those MRI images, they first go to, decide how they are going to ablate this tissue or this tumor. So they try different pulses and different with different locations and heights to produce these lobes and these, focal points, ablated focal points in the tissue to cover the whole tissue. So this is one of the devices that is made by Sonicare, and it is, used in medical centers. And these are the pictures from the device, and it's, how it is been done through the MRI guided therapy. And this is the image from before and pre-treatment. This is the post-treatment image of the prostate, and as you can see, there is a tumor here, but they have ablated it, and you can see the effects. For here, we have a hepatocellular carcinoma. You can see here again, there is a treatment cancer, but post-treatment, you can see that it has been treated. And also about pancreatic cancer, this is the baseline, and this is 22 months later. Also for breast cancer, they have used this for breast cancer, because in all of these cases, there are lots of different methods used for treatment, but they are more invasive than high-intensity ultrasound. So, it has provided a better means of treating these kind of diseases. In the next slide, I'm going to talk about essential tremor. It's one of the pioneer treatments in using HIFU. This is the actual device, which is developed by Insightex, and this is an MRI device, an MRI system. This is the ultrasound probe. This is spherical shaped ultrasound probe, which got FDA, and we have done a lot of, they have treated a lot of patients with this device. So this animation shows how how they are doing this. The patient, there's a cap which is attached to the HIFU probe, and it is going to keep the head in a fixed position. Then the patient is carried to the MRI chamber to first take images and control how they are using the ultrasound to precisely deliver ultrasound probe and ultrasound focal point in the point of interest. So here, as we saw, there is a probe, there is a spherical probe which is consists of different, let's say thousands of piezoelectric modules that can produce acoustic waves and ultrasound waves. So these ultrasound waves are going to be precisely, gathered and focused in that point area of interest, so it can ablate exactly that point. And if they turn on the ultrasound, then this part is going to be ablated. And this is the real image of the ablation they made here. So then, treating essential tremor with this kind of thing, this technology is very, very fantastic and interesting, because those who have this disease, they they have these shakes in their hands and they cannot live their life. And if their works and their life is dependent on this, they cannot live like a normal life. So this is he is an artist. He has the essential tremor. This is his writing here, that he could not draw a circular line or even a straight line between two lines. So you can see how bad this shake can affect his life. So, and this is the point of our interest, that malfunctioning and dysfunctioning in the brain, and we want to ablate this part. And with the help of the ultrasound, we can produce enough energy and with enough precision and tiny enough region, but in a condition of not using any incorporating anesthesia. There is no incision, there is no holes, and there is no electrodes implanted in the brain. There is no skin burn. There is no infection and brain damage or blood clots. So the ultrasound and HIFU is offering something fantastic that would reduce the side effects, but could ablate exactly where we want and produce fantastic results. This is the post treatment drawing of this person, and as you can see, it's much more better than what he has drawn here pre-treatment. And as you can see, after treatment, he could easily pour the water from this cap to the other plate. So this is fantastic, something unusual happening here. Then let's see what's the next. Then exactly the same procedure was also done in Alzheimer. The first person who was treated Alzheimer is this person. I'm not sure how old is he, but it was done in 2017 in cooperation with Sunnybrook Institute, and they have put in this cap in his head, and they are carrying him to the procedure room where there is the MRI device. This is the ultrasound HIFU probe over his head, and while he's awake and seeing everything, he's alive, and they can treat him with this fantastic HIFU probes. So whatever we talked about up to here were for the thermal effects of the HIFU ultrasound, and mostly HIFU, because most of the fantastic results were captured and were given from using this high intensity focused ultrasound. But there are some other non-thermal effects which are mostly mechanical effects. And in order to show them, I'm going to a little bit rock our session with music. I know that you have seen these kind of videos on social media, whether it is Instagram or it is let's say Facebook, that the woman is standing in front of a wall of places, and her hair is moving due to the sound wave coming from this wall. Or even you might have seen this video that
in my hand, I can make the bad guys good for a weekend.
That when the driver turns on the pace, then the hair is moving and reacting to the sound that is propagating in the media of the car. So there is some mechanical happening. So one of these mechanical effects is then is the shockwave. The shockwave is kind of it can produce energy, it can produce force when it's used in, for example, lithotripsy, and it can break down the kidney stone or renal stone, and when they are broken into small parts, then these kidney stones can be removed or can be ejected easily from the bladder. This device is usually used in medical treatment. Another effect of the ultrasound is cavitation. If you remember that I have provided this image at the beginning of our slide, then I said that this is a harmonic motion and harmonic wave, harmonic movement of the air molecules. And if we take a picture from this movement, we will realize that there are some parts of the this media that the air is compressed because the molecules are tight and are in very tight region. But in some areas, molecules are far from each other and they are decompressed. So this can help us, or when incorporated in the tissue or any kind of media that could have vapor or air, then these decompressed zones can provide us with a facility to make cavitation. As you can see here, if we use this ultrasound in our tissue, those decompressed zones will bring the air, will bring the vapor, and make cavitation to occur in these parts, and could provide us with a means of destructing the surrounding tissue, as you can see in these pictures. Because the collapse, when these bubbles, when these cavitation bubble collapses, then it can destruct the surrounding tissue. So this is a means of destructing the tissue without thermal effect. So previously we had this thermal effect, this effect through thermal ablation by using high intensity focused ultrasound in the tissue, as you can see here, schematically. So it could, let's say, also injure and influence other surrounding areas a little bit. And although it is non-invasive, it is focal, it can have that transition and epipheral zone between the central zone and the surrounding normal tissue. But if we use this cavitation kind of probe, then we can destruct the tissue without having that thermal effect, which has better result and can have fantastic results in comparison to the thermal effect, and the tissue can regenerate itself and heal itself. And there are two other effects: acoustic radiation force and acoustic streaming, which are mostly used in not in medical stuff, but there are something happening. For example, in blood vessels surrounding the tissue, which can cause some kind of vortexes, some kind of streaming effects in the blood fluid, so blood fluid flow. So as we fluid mechanics researchers know, these kind of effects can distract more energy and could have cooling effect to the surrounding tissue. So although they do not have direct medical applications, but they are happening in the tissue or in the fluid flow surrounding the tissue. But they have a lot of fantastic applications in non-medical stuff, in microfluidics. We can use these forces to separate molecules, to arrange them in a way that we want them to be. So these are some of the applications, and you are seeing in these videos. Here, for example, you can separate cancer cells from normal blood cells easily. But something fantastic is happening in the non-thermal region, and that is opening the blood-brain barrier for central nervous diseases. As you know, blood-brain barrier, this is the central nervous or brain, and if there's something happening, if there is disease, for example, I don't know, Parkinson or different kind of diseases that are related to the central nervous or nervous system, then with having this blood-brain barrier around the blood vessels. We cannot deliver our, desired drugs to, this area, to the nervous system area, and to treat the disease. So, but ultrasound can help here. But how? You know, they have used these kind of microbubbles and injected into the, let's say, blood vessel, into the blood circulation system. And if there is a drug, besides these microbubbles, if we have injected the drug, or for example, the patient would have taken it nasal through the nasal channel, then there are some drugs in the blood circulation, as well as some microbubbles. These microbubbles are really small, smaller than red blood cells, and when they are incorporated in the blood circulation and we use the HIFU, they will open the blood-brain barrier, and those drugs which are present in the blood circulation can reach to the nervous system and treat those unwanted part, or wherever the region of interest or region of interest is. But to see how it works, I've provided another video from Chen Lab. They presented how this ultrasound probe with with these microbubbles can open the blood-brain barrier. You know, these when we use these microbubbles and put the ultrasound right in the area of interest, these microbubbles are going to kind of expand and compress due to the changes in the pressure in the area of our interest. So these changes in pressure can cause this contraction and expansion in the microbubbles, and these contraction and expansion can open the blood-brain barrier, and the research has shown that this opening is temporary and it's not permanent. So after treatment, after some time, then the blood-brain barrier would be intact and would function as the normal function it is doing. So this was the non-thermal effect, some of the non-thermal effect applications. But here I also wanted to show another application which in which we could use both thermal and non-thermal effects. As well as using it as a drug delivery application. Traditional chemotherapy is kind of, they inject the chemotherapy in your body, and the chemotherapy is everywhere in the area in your body. But with the help of the ultrasound, we can manage this drug delivery precisely to the area of our interest. Here, this video is about the liver tumor, and the area of interest is liver. This is the microbubble I talked about. These microbubbles in this study they're kind of those microbubbles which are used for drug delivery, those conventional ones, because you have this liposome covering, and the drug is incorporated in these microbubbles and could be used for this application. There are, let's say, millions of these microbubbles in the injection, and then the patient is injected with this microbubble. Then the microbubble is everywhere in the body, but it is intact. It's not causing in that capsule, not liposome, in that capsule. So it's intact. And also, it is in your area of interest, which is liver, here, which is liver. So we want to ablate this part. Let's say, for example, this is a kind of tumor here, liver cancer, and you have this drug in the area, in the media. So when you use ultrasound, if the ultrasound applied into this area through the MRI guided ultrasound therapy, as you can see here, the energy is produced, gathered and focused in exact position of our interest, then it can produce those mechanical effects of the pressure to explode these bubbles and to make the drug released in the media, as well as if we use this high energy, high intensity focused ultrasound, it can produce high energy and high temperature, which can ablate the tissue as well. So it is kind of mutual application of thermal and non-thermal effects of ultrasound. And this is the, research and regulatory, approval of the focused ultrasound and their stages. As you can see, this is the FDA approved stage of the, ultrasound, and there are, wide range of applications from cardiovascular, as you can see here. Then, for example, for bone metastasis, they have got the FDA approved. And for example, liver tumor, we have, for example, melanoma. Essential tremor has also got the FDA approved. Prostate cancer, as I said. And also, these different kinds of applications. And this is for oncology, different tumors in different parts of the body. And there are also some other effects in this field. For example, they have used it for sonoporation. You can use this ultrasound probe to break the cell membrane and incorporate these drugs into the cell membrane. Or you can use ultrasound these side cells surrounding these blood vessels to make it expand and dilate. You can use it vice versa for vasoconstriction. Then you can use it for blood circulation and coagulation. Through the ultrasound. And sensitizing to radiotherapy, and even chemotherapy is also available. So these were the, effects and applications I wanted to share it with you. Thank you so much for your patience and listening to my presentation.